Right, so we're going to go into the debate immediately. And the theme is connected objects, aid, drugs, or spies. And I'll call up to the podium Uwe Diegel. Cedric Hutchins is unfortunately back at the hotel. He doesn't feel well, so Philippe Amouyel will replace him. There's Andrea Limburg too, Joël de Ronet, and the debates will be led by Jean-François Lemoine. In previous years, there was a round of applause when everybody came up and sat at this table. Thank you for that. I could have done what Guy has just done and said, well, there are two of them who haven't come and you'd all have gone, oh, but there are two new ones to replace them and they're really good too. And so you'll say, ah. So thank you very much indeed, Guy, for having done me the honor of launching this session this morning. That's wonderful. I'm sure that we're going to be able to show you that health is really part of our life now. And it's often people who aren't part of our life who talk about it, but connected objects are certainly coming along. And you have people around this table who can say a few words about them. Uwe Diegel, who's the Managing Director of ELS Europe. You've probably already gone online to see what ELS is. Everybody's talking about you. And your great specialties is 3D guiders, which is wonderful. And you're a very talented person. Andrea Limburg is the head of a patients association. You defend your patients who are not just the resigned spectators anymore. And for them, connected objects are essential. Joël de Ronet, one of our most brilliant philosophers. I always say that because we're going to have to think about transhumanism. It's something that really is of concern to us. And Philippe Amouyel, who I don't really know all that well, he's Professor of Public Health in Lille. He's a real researcher and he's now launching a major experiment on connected objects. He has a research project in real life. And Guy Valenciennes, who's going to talk about his book, Medicine Without Doctors, ? And we'll see what he has to tell us. It's published by Gallimard, and I'm sure that he can sign a copy for you after the roundtable. Are connected objects aids, drugs, or spies? That's the title of the debate. And it shouldn't be too difficult to answer that question. I'd say aid, yes, drug, probably, and spies, perhaps. And then we can go directly to the conclusion. But before we look at the document that the SHAM team has prepared for us, let me just get you to raise your hands to wake you up a little bit. Who uses an application to count your steps or measure your capacity to run? Who gets themselves weighed on connected scales? All the fat people have raised their hands there. Who measures their blood pressure with their smartphone? No hypertension around. Who is a little bit cautious about connected objects and doesn't really trust them? Well, I think that was well worth debating on because there's no majority whatsoever, as you can see. So, well, look, this is very simple indeed. We're now going to take a look at the animation, the video that the team has cooked up for us. Big Brother City 2035, 7 a.m. Thomas, 55, is in bed and his alarm clock rings. You've slept for 6 hours and 14 minutes as his smartphone connected up to sensors under the mattress. In the toilets, his urine is immediately analyzed. Nothing wrong there. Then it's time to get on the scales. Bad news. The connected scales show that in 1 week his fat body weight has gone up 3%. If this continues, the complementary health scheme will increase his premium again because they have immediate access to all his data. At work, a question flicks up on his smartphone. Do you feel stressed? His connected watch strap has given the game away. His pulse was a little bit too fast because he had an interview with his manager earlier. At 6 p.m. when he leaves work, Thomas is tempted to take get in his car, but the weather is fine. You should walk in the sunshine. Your vitamin D level is too long and you haven't yet taken your 7,000 steps today, his smartphone tells him. Thomas arrives at the sports club. When he clocks in his member's card, his health insurance scheme is informed of his arrival. 20 minutes later, they check that he's still there by locating him on his smartphone. When he leaves, Thomas dreams of French fries, but he's already swallowed 2,200 calories during the day, and it wouldn't go down well with the health fund at all. He hasn't yet got over the €15 increase he had to pay last year for smoking a cigarette. He'd forgotten that the sensors in his watch picked up tobacco smoke, and he feels rather nostalgic. He was one of the first to have one of these watches. His health fund partly paid for the watch in 2015 when he bought it against access to his data. If only he'd known at the time he was 35 and thought it would be great fun. He felt encouraged to take care of his health, and he was also happy to get gift vouchers when he did an hour sports a day. But since the system has changed, no more rewards, at least little extra that's bad for his health. Thomas has to pay a fine, and the health scheme is informed. It's for your own good, his advisor always repeats. You must understand that our interest is that you should not fall ill. I think that we could give the video a round of applause and make 2 comments. Is the person who directed the film paranoid? Certainly. 2035. In 2035, I think we'll have gone on to something else. You've written a book on medicine without doctors. Was it to make us smile, or do you think that that's something that might happen? Well, there's something true in that. The spy aspect is of great concern to people. As you can see, people have data centers and they're getting information from us all the time. It's something that is really happening in the USA. It hasn't yet crossed the Atlantic, but it's going to come. Otherwise, yes, of course, it's of precious help to us. And it's probably a drug as well. There are people who absolutely need that information. Andrea, for example, because you have one of these connected objects that enables you to calibrate your levels accurately. Well, do the lecture there. You started off by telling us about how they can be helpful. I know somebody else who makes a lot of money out of this sort of thing. Well, making money is not a swear word. It's an opportunity in terms of public health, or is it just a huge contract for you? Well, it's both at the same time. But what's brought you here today is what? Well, it's not the money aspect, certainly not. In all the systems, health systems that are based on welfare state, where the healthcare is free of charge, you've got to control the health expenditure. Here, what we're discussing is whether it's something that can be helpful. Is it a normal evolution of the telephone, or is it something else? Well, I'd like to criticize the term connected objects and smart objects, because I think it's old-fashioned to talk about connected objects, because we are really changing our world. We're now in a different ecosystem. Connected objects are what we had 30 years ago. These are words that have gone out of fashion. We're now in symbiosis with tools that are extensions of our body. Well, when you say that something's out of fashion, my answer is, well, what do you propose? Well, you can't say smart systems either, smart objects, because you can already say smart cars and smart houses. It means in real time, interactive and proactive. So it's something that requires a new term. We've been through communications revolution, and we're now in symbiosis with the digital environment. the digital ecosystem, because objects have now become symbiotic prostheses, they're extensions of our body. Well, if you say that to people, are they going to understand? That's why we say connected objects. Well, I'm sorry about the term, but that's what it means. It's rather like smart objects. We can continue saying them, but you've got to explain. Philippe Annuel, you're in real life. We've set the debate now. Are connected objects something that are for people who are in good health, or for people who are ill, or for both? Because you're never quite sure who they're for. Well, for the people they're indicated for, I think they're aids. We have patients who need to do more physical activity. It's a concept, of course. 10,000 studies have shown that it's good for your health. But how are they going to do this? If they have an electric podometer, they'll know how many steps they've taken, so they'll have a reference, and they'll be able to increase the number of steps. They'll have the knowledge they need. So in that respect, it's an aid. But if you haven't got a podometer, your study is not going to be any good. But now what we're trying to do is change people's behavior. It's not just a medical prescription. We're working on hard facts. We have drugs that treat myocardial infarction, but you have to take the drugs. All these tools are going to make people aware of the level of activity that they have, and very often people don't take their drugs because they've forgotten them. So a little reminder, a memory jogger, is a very good thing. You don't always have a nurse behind you to tell you. So I think that's how we can see them as aids. Okay, so you think that this is something that's going to be there to help us. Yes, it's a change in the way you perceive symptoms and so on. For you, Andrea Limburg, you're vice president of the French Diabetics Association in Paris. So you don't really have the choice. You're diabetic, so connected objects are something that have completely changed your life. Yes and no. As a patient and a citizen, we do have the choice. But if you want to manage your disorder properly, then you've got to be able to use these objects. That most of the patients say that connected objects are changing their life. Yes, it enables us to manage the disease better and become aware of how we can improve the way we take care of ourselves. But these are choices that we don't take alone. We make these choices with the healthcare professionals after a discussion. Well, let me stop you. Do all of the healthcare professionals advise these connected objects? Not yet. Well, perhaps the diabetes specialists are different. I don't see a lot of cardiologists here, but I'm not quite sure that the heart rate meters and the podometers are as widely used. Well, it depends on the cardiologists. Some are for and others aren't. But if you take diabetes, you've got this problem of the constant regulation of the dose of insulin the patient gets, and it's something that has to be monitored. And with injections, it's not very easy. Now, here you have a real tool. And what about using contact lenses to see whether you've got glycemia or not? When you talk about connected objects, there are two things that change completely. The first thing that changes is what we call the augmented patient, because with these tools, the patient is in relationship with the ecosystem and can monitor the changes in his treatment. But then you've also got measurable prevention, because for years the pharmaceutical industry has said preventive is something that doesn't bring in any money. But measurable prevention is becoming possible. You can actually measure the results of going on a diet or taking your medication. And in the ecosystem, that's going to be the challenge for the future. Guy Valenciennes. Well, it's interesting to hear you saying that about the patients and the doctors, because these applications are going to have to be funded and reimbursed. And the debate is going to be, if you don't use this, is it going to be taken away from you? Which is what happened with the respirators. So to where are we, how far are we going to go? How did you come to connected objects? I talked about money earlier, but there was probably another reason. Well, historically, I've always manufactured medical devices, blood pressure meters, for example, and they became connected up naturally. So it's not really an invention, but I think you've got to draw a distinction between connected well-being and connected health. Well, if it's the gadget market that we're talking about, well, everything's going to be connected in any case, but in 2 years' time. If you've just bought a computer, you probably didn't ask the person who sold it to you whether it was possible to connect it up. This brings me to the last part of the dangers of connection. Well, medicine has always been different from well-being. It's always been something that has been managed by doctors, managing the symptoms. But even if your company is a big one, how do you manage with the arrival of the GAFAs? Well, the GAFAs are really extraordinary. And we're in the forefront of connected health worldwide. But I think that the arrival of Google and Facebook has got health into the forefront of everybody's concerns today. It's rather like when safety belts were put into cars. There were actually strikes when people were first told they had to use them. How dare you tell me what I should do in my car? But now it's become something automatic. Yes, but the challenge wasn't quite the same, was it? What I mean is that if you're talking about Parkinson's disease, there's not quite the same thing at stake, is there? But this is something that you're doing without thinking about it, and it's going to happen as well for your health in the future. The GAFAs are new monopolies. We're nations, we're states. They're states within the state. And you've also got the NATAs, Netflix, NBN, and so on. And it's rather like Uberization. Everybody fears that they're going to be Uberized, and the mediation with the banks is something that's happening too now. The whole point is not how we should be able to fight against them, is how we can work with them. They're complementary. We need them. They create added value. Well, I hope you're making notes of all this, because I did an animation with Luc Ferry, and I asked him who Hubert Pupp was, because I hadn't read his latest book, and it didn't make him laugh, actually. Philippe Amouel, your vision. Well, I'm rather surprised in this debate, because as a doctor, I've always complained that my patients didn't take enough precautions, didn't follow their prescriptions, didn't take their insulin regularly, and so on. Today we have the means to control this, and we're going the other way. It's rather like the pendulum of a clock. It goes one way and then it goes the other, but it'll end up by stabilizing itself somewhere in the middle. As soon as something's connected, it's good. So we've got to start assessing whether it does actually measure what it's supposed to, if it's reliable, if we can let a patient go off with that tool, and because the patient's going to be responsible for it, and we haven't got to that level yet. But as far as the GAFAs and the others are concerned, everybody criticizes them, but everybody uses them as well. If we didn't have search engines, we'd never be able to get all the information that we need. It depends how you use it. It's the extension of that information that's important. It's up to us afterwards to use what's good in the system. What does that mean? That means that the medicine's position may be different, but it's an important one all the same. And there's going to have to be some sort of intermediation somewhere between, I've got the information, I've recovered the information, but how do I use it? Yes, because we don't know what's waiting for us, what model there is to analyze all this. But what I'm concerned with is that we'll get to a point where everything's connected. We've got Laurent Alexander somewhere in the room here, and we have heard that if the doctors don't watch out, they'll be the nurses of the future. So what do you think about the doctor's role? Well, all the roles are going to change. The role of the taxi driver has changed with Uber. The doctor's role is going to change as well, but it won't disappear. But what's his role going to be amongst all these connected objects? Well, I think that increasingly the doctor is going to become what we could call a health advisor, which means that according to the capacities in prevention and measurement that he has, he'll be able to advise people about how to manage their lives. I'd say that this is sort of ecology, economy, biology, bionomy, which is management of your body and your mind. And the doctor will become a bionomist, that's to say a health advisor, using all the modern concepts of nutrition, the ways he has of assessing drugs and advising people on how to use them. You represent the patients. Are they impatient to have more and more connected objects? Yes, if you take the example of diabetes and you take a look at the technology of diabetes today, although I think they're used in other disorders as well. I have an insulin pump which talks to my continuous glucose reader, and that means that it gives me far more leeway to take the scores of decisions that I need. I've got the information, I need to take them better. And do you think that the doctors are playing the game? What happens in real life, doctor-wise? Well, I think that little by little the doctor's job is going to change. And I think that the relationship between the doctor and the patient will be something very different. They'll be on an equal footing. The doctor will bring his expertise to the table and help the patient to manage his disorder. Do you think that there'll be connected booths in desert areas to make diagnoses? Well, I haven't thought about that, but anesthetic robots have become reality, and there are places where the anesthetics are administered automatically in 5 or 6 or 7 operating theaters. It's pain-free, it's accurate, and it works very well. My role as a doctor is no longer the role of an expert. Economically, it doesn't make sense. Economically, a GP or a specialist does 50% of the procedures that could be done by other people. There's no point in studying for 12 years when some of the procedures you do could be done by other people. added to which some people who do these procedures do them even better because they do them very regularly. You've seen that with the nurses. So that would leave you more time for your clinical duties, because, well, people are going to be a little bit upset about that, aren't they, Philippe and Mouel? Well, we've got to anticipate. Well, doctors won't disappear. If you break your leg, you're going to have to go and see a surgeon to get it set. I think you've got to draw a difference between two things. The job is changing, but it's not going to disappear. The thing is that we've got people waiting in consulting rooms, and I think we've got to reduce those the waiting time. Aren't the lawmakers going to have to be very vigilant? Well, not only the lawmakers, but the patients and the healthcare professionals, all three at the same time. Because if you think of your doctor as an advisor with connected objects, there are three dangers if you take a close look. First of all, you've got cyber medicine, the fact that people go onto the internet and share recipes on the social networks too. And self-medication is a problem. Thanks to the social networks, people share their treatment. So cyber medicine, self-medication, and the wrong drugs are the three main dangers, and we'll certainly be talking about big data in the future as well. Well, that's something we could have described by saying that the doctors are afraid of losing their power. Well, you're always afraid of losing power in politics, in the industry. And last question. With globalization, instantaneous globalization of all of the inventions today, is that a problem for you? Well, it certainly is a problem. I have a clinical culture in medical research. Today it's become far too easy to put devices on the market. Every day a new gadget comes out, and it's beginning to gadgetize the industry completely, which is going to be a prejudice in the long term. As a doctor, I think you've got to draw a clear distinction between what is medical and what is a gadget. Somebody laughed, and that really disturbed me. We've just got time to conclude. I thought you were going to do a little conclusion. Are you going to do a conclusion? Well, yes, of course I am. Keeping in mind what you said, what are we going to do? Keep 1% of the applications that we have. There's a huge bubble, but we'll only keep the minimum. So you think that it's an aid. Nobody's against? Well, let's go on to the second part, which is it a drug? Is the word drug appropriate or not? Yes, it is. Today, what I see is that most people who have a connected medical object don't need one. They buy it because it's trendy and cool. And most of the people who buy an activity tracker are already athletes, and they run. So it's just to measure their performance, and the next stage is going to bring out connected objects that become part of your life. No, you're just describing a compulsive purchaser. I'm talking about drugs. The thing is, you buy it and you use it. Is it going to become a drug? As a manufacturer, for 20 years, I've only seen disorders, but now I see well-being. People buy these objects because they want them. And 60% of those who do buy are going to buy another one. Does that make it a drug? No. I'm just leading the debate. you're describing a compulsive buyer, but not somebody who has an addiction. Well, there are addictions to sport. People who run the marathon are addicted to the marathon, for example. I'm a surfer and I'm totally addicted to the sport. I think about the weather forecasts wherever I am. It's rather as if I was an addict to my eyes, my ears, my legs when I use these connected objects, because they're extensions of my body. We're talking about a digital ecosystem. We've got these tools, and now they're on us, they're part of us, and our body is becoming a measurement tool itself. Am I an addict to my eyes or my legs? These tools are going to become part of our body. Andrea, do you find it strange to compare these subjects to Professor Duranier's surfboard? No, because you don't feel quite right. For a few weeks I didn't have my continuous glucose monitor, and I didn't feel quite right because I was in the habit of having one. But you're not describing a drug, you're describing something that's essential to you. Cocaine is not essential, even if you do take it, even it helps you to be the best debate leader, but it's not essential. No, of course not. But I've often heard the argument, well, aren't we creating a generation of hypochondriacs? Yes, well, I think that was that hypochondriacs have always existed. Well, don't they all have these tools in their pockets now? Well, they have the best tools for the... Well, there are people who are addicted to smartphones. There are special clinics to deal with addictions to smartphones. So there is a problem of addiction. For example, you've got a watch. I haven't got one because I've got a smartphone. Well, yes, but you've got to get it out of your pocket to look at it. There's a generation that's become completely addicted to smartphones. Well, we're rather elderly. Perhaps we're probably about the same age. Well, we well, now that had quite an effect. It was an announcement. Philippe Amouyel, 3 things. The first is that it's not because you've got connected objects that it'll change prevention. Prevention is something that people who don't really need do today, and we need to get those who need the prevention to do it. The second is the concept of a drug is based on the rarity of something, and buying a connected object costs quite a lot. A smartphone costs quite a lot too, so you're attached to it. You've invested in it, and I think this is something that's going to disappear when it becomes very ordinary. The more ordinary they become, the less these objects are going to cost. The economy is going to have to work, but the prices are going to decrease and they will become much more ordinary. After the bubble, which is essential to find something that's really innovative, the market's going to stabilize. We'll see which ones work and which ones are recognized by the public authorities because they really do provide a benefit. But this phase of effervescence, which is wonderful, is something that's going to change the job we do. And once we've got through that phase, then we'll come back to something a little more rational. Now, I think that when we get to this stage, when you have people sleeping on the pavements for days to buy a new smartphone, they're not buying an object, they're buying something that is an extension of their body, senses they don't have. We have new senses with these tools. We're buying something more to be different. Well, the examples that you've given, the people who queue up for a new iPhone or something that make you think of a cult. People, and of course that's the game that Apple is playing there. Then you've got the reality of things. You've got people who buy Chinese smartphones that work just as well. And you're quite right. The new function of social communication, which is far more horizontal than vertical, it has been up until now, means that people really are connected. What is this, a private discussion? You're talking about using a sextant there. Well, I have a whole range of products like that, and I'm surprised to see that I get so many messages from them. This week, be careful, you've gained some weight. But you send the messages in. Well, I've been mainly working on chronic diseases. When you're overweight and you have chronic pathology, you've got to have a relationship with the patient. Let's go back to the previous debate. It's an aid, yes, for people who are in good health or for those who are ill, for both. You send emails to people who are diabetic, that's not a problem. But somebody that has no disorder whatsoever, who's just bought a podometer and is constantly getting mails saying, be careful, you're participating in the addiction in a way. Well, it's the patient who chooses. The patient decides to receive messages of encouragement. Dear Jean-François, you've walked 10,000 steps today, continue. It's a way of developing the addiction even more, isn't it? Andrea? Well, within the scope of a chronic disease, you've got to be very careful. You've constantly got to have reminders or warnings or alarms to make sure that you take care. Because if you've got a chronic disease, you already have quite a lot of stress to bear, and the burnout of all these messages can be a bad thing as well. So you really do need to be supported. Okay, so you say that these patients have an addiction, but it's a good addiction. Well, there can be cases of burnout or overload of information as well if you don't know how to interpret that information the right way. These are what we call self-quantified data. You're interested in what your body is doing, and that's why people are investing more and more. So is it a drug or making the patient responsible? Is it something that's going to change the person who has the device into a player in public health? Well, I agree on that, because once we've got through the marketing and all that, then we'll get into that state of mind, the concept of empowerment and self-reliance. And it'll probably be something that the patient will be able to take charge of. Joël Dorogné, I think that with the discovery of epigenetics and the fact that behavior can change your genes and stress management and harmony of the social and family networks, the fact that you can say, I eat the right things, I do exercise and so on, is good for me. But measuring it is something very different, because we can measure more or less accurately. For the moment, you're just assessing what you do. You're sensitive to the signals of your body without connected objects, but even more sensitive to them if you can assess them, because these objects give you an assessment. Now let's leap forward. These are going to become collective tools. The fact that you can't assess their performance for the moment is a bit of a problem. Yes, but that's what the gaffers are going to be able to offer us. Couldn't we talk about the necessity by Jacques Godot? The fact is that you've got to be able to determine. It's a form of determinism. Philippe Amuel, you're the generation of the doctors who've always been very keen on the rules of hygiene and good diet and so on. Are connected objects going to bring these rules back to the right level? Well, that's one of the big challenges of prevention. It's going to change people's behavior. It's something we can't do today, and it's probably a way of changing things, because the patient is going to become aware of things and do them. We're going to launch a big program on physical activity. Sum that up in a few words. Well, it's a program. The challenge is to equip the largest possible number of people at the lowest possible price with a podometer, with a special application that only measures the number of steps. That's all it's supposed to do. It doesn't measure whether you sleep well or not, and through these bi-directional tools, we'll stimulate people, create challenges. For example, call up your colleague to see if they work more. The goal is to increase the physical activity of the population. We're in a world in which we accuse all of these objects of closing people in. And here it's rather the contrary. You're part of a community. It enables self-assessment and co-assessment. With the social networks, co-assessment becomes something possible through the Facebook and the social networks. Guy, in the second part, is it a drug or not? What is your conclusion? Well, I'd like to remind you of the person who went into a field and couldn't choose which cereal to pick and died of hunger. Can you just imagine a vacherin, a strawberry vacherin full of cream? The best ones are made in Chamonix. 2,000 calories. What do I do? Do I eat it or not? That's the most dramatic part of it. This always ends up in a personal conversation. We'll talk about vacherins later. The third part. Now, this is a debate, but I think we're going to come to a consensus, because we're going to talk about connected objects or symbiotic objects for the purposes of spying. Who controls these waves of objects? The only person who has access to the data is the patient himself, who chooses to participate, because everybody now is talking about data security, but it's the patient who chooses to participate. We know that people murmur that Big Brother is listening in. And we heard a murmur there. You're saying that the patient is in control. Well, I have no access to the data. I don't host the data at all. Mr. de Rony, you don't agree. No, the patient doesn't control the data because they're stored somewhere in big data and it's going to become a profiling tool. Take two simple examples. When you go on Google News, they know what you're looking at in most cases, and they are going to give you recommendations. It'll be something on politics, for example, or surf for me, yes. And when you have a look at a commercial product, that will flick up on the screen, or when you go on a travel site. What scares me with big data is not Big Brother. It's the millions of little brothers. That's to say, everybody. Your friend in the office, your neighbors, the social networks. We're constantly spying everybody else thanks to these tools. You have a paranoid trend there somewhere. So on one hand, we've got the manufacturer who's being very angelic about it and who's saying, oh, your data is absolutely not. Where is your data then? It's on a server. Here in France, it's hosted and nobody can hack into your server. Well, any hacker who can hack into a MasterCard can go into a cloud. So there's no data protection at all, really. So all the data is technically available to any little hacker who goes in to get it. But whatever the level of security of the data, whatever the level of security in the cloud, is safer on the cloud than if it was written on a piece of paper in the doctor's surgery. And the current system where the mutual funds don't know when you have a disorder can't last. They have the solution. You've got to tell them what you've got to for them to give you the right solution. We can now decode the genome. And if the health insurance scheme has all your data, well, we've got to determine, first of all, what data should be served and what shared and what will not. What do the doctors and healthcare professionals think about all this? Well, as soon as you put something on the internet, it can be hacked into and it can be retrieved. If you don't want it to be hacked into, you don't put it on the internet. You don't put it in your computer either. You just leave it on a piece of paper. The benefit that I can draw for that is going to be far more advantageous than just knowing that I weigh so much or I take so many steps. But there is a true danger there. It's true that we are in a very democratic environment. People respect private property. But when you see the vice president of Google, who says that private life doesn't exist anymore, he bases this on a very, very simple precept. Before, he said, life was in villages. Everybody knew everybody. The postman told everybody about everything. The more we become industrial, the more we live in cities, and we have a private life because people are becoming anonymous. But now we're going to go into a big village system. Well, we've got a world village, so that's not something that pleases you, Joël de Rony. Well, I think that private life is no longer going to be a right. It's going to be a compromise in the future. If you go on to Amazon, they say, Mr. de Rony, you haven't been to visit us for the last 2 weeks, but the person who bought the last book that you bought also bought this book. So I'm going to accept that that is a compromise. So you'll accept the neighbor's advice, but not their rumors. Well, I think your buzz can help you to improve your reputation. Well, is there anybody controlling all this? What does the lawmaker say about all this? Well, the government, there are laws that exist that stop us doing what we want to do or what we could do. It's a new technology. Everybody is using them today. We now have big data, and it's rather like counting logs. You put it on the computer and you count up data, but we don't know how to use it. And as a host of data, it's only if the data is anonymous that I can actually use it for studies. Well, if you've got a logger accumulating logs to be able to use them later, why not? But I think you're going to have to do an indirect research to see whether it changes people's behavior. We're going to have information. But I really believe that it's not that useful. It's sort of compromise. It's something that we already do. The example is advertising on Amazon, for example. And we've got to take a look at why we use it, for what reason. Is it useful? Things have to be inspected, and there have to be sanctions or penalties. Let's take the example of genetic data in France. If the police have letters derogatory, they can actually take a look at your genetic background, and that will tell them whether you've got the BRCA1 gene, which will give you breast cancer, and so on. Would you be in favor of decoding the genome of politicians when they stand for election? Well, you've seen that Obama has just agreed to have 1 million people put on a database to do preventive medicine at last, but it's still prohibited in France. And what do you think about that? Well, I think that that's something very basic, accepting putting people's personal data on a database. What did Microsoft do? They've stored a whole series of pieces of information for doctors for the purposes of preventive medicine. When you go on Amazon to buy a book, they advise you to buy another book. If you go to the Mauritius Islands, you accept other suggestions as well. But if you have somebody telling you ought to go and see an osteopath, you wouldn't accept that. Professor Dronet is somebody who you know what he's read and what reading advice has been given to him, but you can't give him an advice on his health. I do a lot of genetics, and we do complete sequences, and I can tell you where you were born and whether your father is your father or not. So we've got that sort of information. Just to reassure you, only 4% of the population have problems on this level. Somebody on the internet offered DNA testing at very low prices. What do you think about this? What you can do theoretically is fine, but Uwe says you can't give people advice. I think that Philippe Amouyel is capable of saying on internet, you should do this or that, but he won't do it. Well, who tells you that? It's a question of accountability, which has always been the problem of telemedicine, and well, I don't think it's possible. If you could do this, would that really be in favor of public health? Would it? Well, you need to take a look at telemedicine and see if it improves health or not first. Well, somebody found out through genetic testing that he had 45% likelihood of having Parkinson's disease, so he founded a foundation to treat it. And there's no point in having people freaked out because they think they're going to have a disease. It's rather like alcohol and tobacco. You can screen for all the future alcoholics. The Chinese are now sequencing 1,000 children who have an IQ of 130. And we're now we've gone from repairing to augmenting. People who do this are really going into the fantasy of transhumanism and genetics. I think there are some things that are real. Physical activity, for example, sequencing the genome. There were 3 searchers in bioinformatics that picked out a certain number of sequences, and they put and they found 10 sequences that they were able to identify. Not only did they identify the people, but the descendants and ascendants. So nobody's going to be able to guarantee confidentiality for the moment. It all depends on what people want, whether they want it to be on the internet or not, and whether it should be of any benefit or not. You'll have noticed that we're discussing all these things as if we were discussing mechanics. I agree that it's the usefulness of the data for the patient and the way it's used that's important. Let's take a precise case. You're diabetic. You don't want your bank or your insurance broker to know that, because it would change the premium you pay. It's something that we're going to have to be very vigilant on, and the users are vigilant in that respect. The data must be used properly. And what guarantee do you have? Let's have an example of spying. I've got a connected pair of scales, which is really connected. My weight seemed abnormal to me. And then I saw that my char lady weighed herself every Friday, and actually it was her weight that flicked up on the scales. She's Polish. And I said, you have gained some weight, Milena, 1.5 kilos. And she looked at me, and she still hasn't understood how I know. And this little example is very simple, but it shows that inside a house, in one household, that's where spying starts. What guarantees do you have? You saw the film. Everybody applauded. probably because it was the first video, but what do you think about that? Well, the other aspect of the problem, since 2012, I've got a diabetes management program, and I have 12,000 diabetic patients who are identified and who receive messages every day. They say, for example, Mrs. Cohen, your glycemia has increased over the last few days, or on the contrary, your levels are very stable. Tell us how you do it. And everybody shares the information and takes advantage of it. Well, it's all sounds very good. We had a group of children in Strasbourg who participated in an epidemiologic survey, and we can bring out unequivocal data. For example, if you smoke, it's good for breast cancer. You know what the first risk factor in life is? Well, it's being in bed, because we all die in our beds. You can make statistics say what you want them to. Is it perhaps because women who smoke have fewer children, or, well, of course it could be. Well, data mining is something very complicated. We're changing our research models now. Before, the model was that you had an assumption which you checked out. Beside that, you've got big volumes of data mining, and we look for assumptions when you didn't have any, and you made associations and said, well, this is associated with that. But it was just a statistical link, and then we did another model to see whether what we've observed was true or false. There are quite a lot of articles on this that concern the fact that there's a new science that's coming out. The information exists, but it comes out of a huge mass of data. And you've got marketing and behavioral and sciences and other parameters. But beside that, the simple fact of having carried out a transverse analysis means that we only find the risk factors afterwards. And there are biases of survival that we don't even understand. I think data's always existed, but once again, you've got the pendulum effect. We've got wonderful tools, and you can have access to data immediately, and it's magic, but you've got to assess the results, and that's the important stage. You could perhaps think about working in an insurance company one day. Well, they already do that very well. They don't need me at all. You're saying that hijacking information is easy. But don't forget the Volkswagen business. I'm not worried about it because I haven't got a Volkswagen myself, but as far as the mutual health funds are concerned, I'm not trying to be angelic. Are we really protected from the extremes? The whole issue is to know what the advantage of spying would be, power or money. Power and money. And as you were saying earlier, if they have my data, personal data, or your personal data, it might be of interest so that they can say, take care, you have this or that. But there are also a lot of very powerful protection tools that people don't even know about today. Anti-spyware, you've got tools to encrypt mail that people don't know about. Well, why don't we make them compulsory? Well, we could. There are 128-bit encryption systems that are very effective. But there's probably always an open back door through which the hacker can go. And I think that protection systems are becoming better and better. People just don't know about them, and they don't have the capacity to protect themselves on the internet. There are systems that are beginning to be set up, and today there are 113 medical applications that have been validated amongst 2 million applications on Google. Who are going to assess them? Well, people are going to need tools to do that. Well, digitally, people don't know how to protect themselves, but they're going to have to in the future. There are two big trends. At some point in time, with the transmission between the social networks, people may be challenged because there's economic logic behind all this, and millions of people put information on Twitter or internet, and negative information can have a very negative impact. So that is the first way that you've got to regulate the system. And with the health insurance system, everybody pays for some people who are sick. And if you're not sick, you could very well not be insured. A lot of people could probably do that if they had the information. So even the model for the system could be challenged. Conversely, those who are in good health would need the insurance, but people who have a particular disease could get together and pay €100 a month for a small group, and the interdependence would raise as much capital as the WHO uses per year. You were all very kind to the gaffers and so on, and the natus. The gaffers and the natu, you were very kind to them, so you're not concerned at all about these things. You only see the positive sides. No, I'm not kind to them at all. What I call state enterprises, I thought it was positive in comparison to the immobile state. But we're all addicts to Google and Amazon, because they help us in our work and our lives, and we give them some high added value information. Governments try to fight against Google, but they can't do it. So what is the only way of co-regulating the system? That is to say that the people who are connected up in the social networks and have quite a lot of clout, and a cyber boycott is something that could exist, and we could fight against them, not to destroy them, but to restrict their power a little. Right, well, that will be the conclusion, and I think that this is Philippe Amuela conclusion. Well, things are changing fast. Things are going to stabilize in a few years' time. New things are going to appear. And I think we've really got to make the patients accountable for their health, necessarily through medical intermediation, which is something that's going to have to be integrated into the system with the awareness and action in prevention to improve people's health, this is going to be achieved at the cost of restricting a certain number of fundamental liberties, of course. You were eagle. Well, today we're switching to the next generation of health. We're at 2.0 today. We're going to be at 3.0 in the future with wearable technologies that people will wear and choose. And we'll also have forgettable technologies that will be around without you having to even think about it. People are going to forget the technology and just use it. Well, of course, the consumer is the most important part of this story. Well, I conclude by saying that this is going to be something that will be extremely useful to people who have a chronic disease, because it means that we are aware of our health and we can take action on it. And for some, the goal is empowerment, making the patient self-reliant so that they can continue looking after their health and to respond to the needs of the patient. These objects will have to be developed with the patient so that they really are truly useful. Well, we've almost finished the round table. We have 58 seconds spare, and very often Laurent Cabrol does the weather forecast very, very fast, and we've got Guy beside me who will be Laurent Cabrol today. There's the danger of the GAFAs, and you said that they were not going to be a cult, but I think they're all transhumanists, and I think that they're selfish, narcissistic, and elitist. They focus on individuals, whereas the future is going to be a collective concentration of tools and hyperconnection and artificial intelligence. Well, that is a lovely weather forecast for tomorrow. I'd like to thank the speakers, and I hope you took pleasure in listening to them. It was a pleasure for me, at any rate, to lead the debate. And I'll show you how you can change a success into a triumph. Thank you to the Tribune at Cham. Thank you to all the team, without whom we would still be in Paris.